Hi, my name is Rajarshi Mandel, and my project covers modeling malaria dynamics for optimized allocation. Despite being both preventable and curable, malaria causes 250 million cases annually. Africa accounts for 75% of cases, with children under 5 making up 75% of total deaths. Beyond health metrics, malaria stunts childhood development, reduces workforce productivity, and can cost countries up to 1.3% of their GDP annually. Insecticide-treated nets are bed nets coated with insecticide that serve as both a physical and chemical barrier against mosquitoes while people sleep. Each ITN provides protection for 3 years with a cost per life saved of just over $1,500. In some communities, ITNs are repurposed for fishing to feed families facing food insecurity. However, pyrethroids leach into the water, harming all aquatic life. With steady annual funding, optimizing ITN allocation with a human centered approach remains crucial to maximizing lives saved and impact per dollar. Our malaria modeling can test ITN allocation strategies with challenges like immunity loss, mosquito biting seasonality, and net degradation. Our reinforcement learning agent outperforms static policies by learning from our indeterministic simulation environment. We extract the logic behind each allocation so organizations like the Global Fund can adjust for sudden disruptions like floods or governmental instability. Dr. Irish, a technical officer at the WHO Global Malaria Program, told us that tighter weaves and better materials could extend ITN lifespan to 5 years. This direction was not pursued due to our lack of manufacturing equipment. Anti-malarial drugs are currently infeasible at scale due to the lack of infrastructure for rapid diagnosis and timely delivery. Indoor residual spraying is another prevention strategy that uses more toxic insecticides because they are applied to walls. Governments invest in these complementary strategies because complete malaria elimination requires a multifaceted approach. Over time, malaria modeling has evolved from simple differential equations to sophisticated compartmental systems with many influences. Our work bridges three domains that were historically pursued in isolation: compartmental modeling, reinforcement learning, and interpretability. We use 6 data sets to estimate realistic coefficients in our malaria model. Most nets in northern Somalia were under a year old, while in Madagascar they were much older. This shows clear regional variation in ITN age. The box plot shows increasing variability and pyrethroid resistance over time, while the map displays mortality studies with local mosquitoes. These two line plots show the result of both interpolating and jittering augmentation on the mortality data. We initially used GANs to model resistance trajectories, but pivoted to a variational autoencoder due to mode collapse and overfitting. The VAE learned a diverse 3D latent space, allowing us to generate varied resistance patterns by sampling from a widened distribution. These three equations explain how we computed insecticide resistance, seasonal mosquito biting, and ITN impact. The force of infection adds nonlinearity to our system and ordinary differential equations for both human and mosquito compartments. We evaluated the reproduction number to be around 4 for our mathematical model, which aligns with malaria being endemic across most of Africa. The simulation environment had 5 counties with a total of 52,000 humans. In each of 3 mass distribution campaigns, 13,000 ITNs were distributed. DQN failed to propagate useful learning signals across episodes, so we developed a custom state action regression architecture. For interpretability, we applied SHAP and decision tree distillation. We found that higher precipitation increases vegetation, boosting mosquito breeding and malaria risk. We also found urban and rural economic variations in ITN ownership differing across countries. Here, we observe correlations between malaria prevalence, environmental conditions, and population factors. This chart shows sharp drops in exposed and infected humans after our mass distribution campaigns. Our SAR algorithm doubled the number of malaria cases prevented compared to static allocation with the same total number of ITNs. Our optimized allocation yields a cost per quality of just $60, far below the UK National Health Service threshold of $33,000, showcasing our exceptional cost effectiveness. Recovered humans, biting rates, ITNs, vegetation, and population were most influenced SAR outputs as visualized from the SHAP values. Our theory of change details how research outputs, sponsor engagement, and socioeconomic development work together to support long-term malaria prevention. Full details of each impact pathway are in the written report. One limitation is that unexpected political instability, border closures, and damaged infrastructure can delay or prevent ITNs from reaching their intended destinations, creating implementation gaps our model cannot control. This framework can be extended to other vector-borne diseases like dengue or Zika. In the future, we will develop a dashboard that integrates real-time data and RL-based ITN allocation to support organizations through end-to-end distribution. We are grateful to Akshay, Schaefer, Uliana, Beck, Dr. Seth Irish, and Dr. Clara Champagne for their time and practical insights throughout this project. Thank you for listening.